patients coming in for removal of a couple skin lesions. You can see down here, can you see that rather? This is just a scaling patch. This is consistent with a seborrheic keratosis. When it's flat like this, you have a couple of removal options. These ones that aren't bothering so much, I've treated those with liquid nitrogen. If you treat those, I find every 3 weeks to every 4 weeks, these will fall off nicely, and that would be the ideal circumstance because you'll have minimal scarring. Come around here to this side, same type of thing here, and these thicker patches are the same issue here. This is more of sebaceous hyperplasia. Here she has what we call a variant of a skin tag or an aquacordon. I don't know why that term is what it is, but we've frozen underneath it. And we're just going to clip that off. It's obviously in a bad spot for her. If this was somewhere else, you could also freeze it. It would slowly shrink. That's just removal for her because I wouldn't have her subjected to having to leave this there for months on end. We'll just take it off. And similarly here, you see this is another seborrheic keratosis, but it's more pedunculated. So again, we can either freeze this every 3 weeks, or we froze under this, and I'll use a cautery unit or a Bovie to cauterize this. It's a quicker way to remove these type of lesions. So we'll scrape it, and then we'll just use a scalpel to clean up the edges. You okay?
Yep.
Feeling fine?
Mm-hmm.
Doesn't hurt at all when I push there?
No.
So for these ones here, and you have to be aware of the fact the scalp, the face doesn't have a big blood supply. So I prefer to use scissors as opposed to a scalpel because it has a clean edge on it. And as usual, we'll always send it off for pathology, even though we're pretty confident in what it is. So here again, I tell residents, don't be worried about how you do this, because if you're nervous or you Skype it or you don't cut clearly across the edge, you can always clean that up after the fact. So this is the hypercator here. It's going to make a buzzing noise. So I want to put pressure right on the spot and slowly come off of it. And you can see how that cauterizes pretty well. So these spots around are just where I injected above that window. So all I'll do now, just to clean out a bit further, I'll take a number 15 blade. So this is what I was talking about. If my edges aren't good, then with this step, I'll clean up whatever's excessive. And then that'll be nice and flat. And essentially what I do now is I'll heat this with the hypercator. It's not a frequency. So I did have it set to the frequency of 12. This is now at 7. And this will just add a gentle cautery here. Just like that. And that'll scab off and fall off in a week and a half or two, and that'll heal in really nicely for us. Now coming over to this one. So the only thing I want you to see with here is I'm going to cauterize this a bit, just to see how that reacts. See how that starts to almost emulsify a little bit? That's what seborrheic keratoses do when you introduce current to it. Just like that. So what I'll do, just to make this simpler, because this is frozen, I'm just going to grab this like this, and take this off. So I don't have much volume to deal with here. So this is a good example, where you can see that if I left tissue behind, like I've done on purpose here. You okay?
Mm-hmm.
Not hurting?
No.
So now, I'm just going to apply it directly here to the remnant. And you see how it just sort of starts to emulsify. Just like that. When I've done that enough, then what I'll be able to do is just take my scalpel and scrape it off. So it loosens it from the basement membrane. Now, see how that just comes right off? Just like that. This is certainly the quicker way to take seborrheic keratosis off. So if I have somebody who has a wedding and it's coming up quickly, we'll do this. Here again, I'll game down just a little bit. And just do a gentle cautery. You can see from here, I'm still with more residual than I thought. So what I'm going to do in that case, I'm going to grab the scalpel. Spread that out a bit. And I just tape that down. So that's just scrapes off. Not that that wouldn't heal properly, it would. It'll just take longer. So the more of those ridges that I can take down, the quicker this will heal. So now that's done with that. Now I'll lower the gauge further. This is down 6 now. And I'll just add a gentle layer. And this actually is like a variant of a scab. So it looks a bit unsightly now. This whole area is going to scab off and fall off, and then she'll have new, fresh skin in about, I'd say 2 to 2.5 weeks. And just like that, you'll be good. That's it. So this is just a follow-up video. We took a skin tag that was growing out of the left nostril off, particularly on the left cheek. There was a seborrheic keratosis that we had cauterized off. You can see now, this is a month and a half later, how well that's healed.